So this video will touch on pregnancy. So your exercise response will be your body undergoing hormonal changes leading to an increase in flexibility in joints and an elevated heart rate. Some of the physiological changes are lower oxygen availability and a lower endurance. So how exercise testing is altered. You want to use aerobic submax tests with physician supervision to determine the effectiveness rather than the maximum aerobic power that you're generating. You want to monitor close for any fluid leaks, dizziness, painful contractions, shortness of breath, chest pain, calf swelling. You want to avoid high intensity or high altitude. You want to stay hydrated and avoid hot environments. For your workouts, you want to avoid anything that's contact, has risk of falls, and change the directions due to the increased flexibility in your ligaments. You want to completely avoid any supine activities after your first trimester, so anything being on your back like sit-ups. This prevents potential pressure on your vena cava, which this pressure can lower the blood flow to your heart and to the baby. So exercise prescription, some things that you can do. You can do about 20 to 30 minutes a day is normally recommended. So that's about a little over 150 minutes a week, or about 150 is recommended for that too. Your rate of perceived exertion should be 5 to 6. Performing a talk test, so making sure your client is able to speak with you while they're doing their training and they're not too out of breath. This helps you monitor their heart rate without actually having to have a heart rate monitor or anything like that on. Just making sure they're not going too high up. You can do aerobic and muscle strengthening. So some activities include swimming, stationary cycling, walking, low impact aerobic, and running. You can use resistance exercise, of course, including safety and limiting your risk. And another great thing to include is pelvic floor training, like Kegel exercises. And this is the pregnancy exercise video.